Thank you for joining us. This is a panel discussion on performance management. And I'm joined by several HR professionals. It's sort of a big topic, but we should be able to cover everything in the hour and a half that this panel is going to take place. I'll start up by everybody's going to introduce themselves and tell them a little bit about who they are, and then we'll get into it. So with that, I'm Emil Kresl. I'm the Director of Learning Development here at the University of Texas. We handle all the professional development, career development, that sort of thing for anybody who works at UT. I've been at UT for over 20 years now, and this is the L&D office is a new office, though. It's only been around for 3 years. And Karen, if you want to introduce yourself next.
Hi, I'm Karen Chawner. I'm the Director of Strategic Workforce Solutions. We help with employee relations and performance management and compensation and classification. I've been here for 13 years. I had to do the math because it's just kind of flown by. And then before that, I was in HR and a public accounting firm and a remodeling company. So I've seen quite the variety of employee relations cases.
We look forward to hearing some stories. Jeff, why don't you go next?
Okay, I'm Jeff Evelyn. I'm Assistant Dean for Finance and Administration at the School of Architecture. I'm in my 28th year at UT. And I love every one of my co-panelists.
That's kind. Thanks, Jeff. Elizabeth, how about you?
Well, that's hard to follow. Elizabeth Steinour, and I'm Executive Director of HR for the Dell Medical School and UT Health Austin. I've been on campus for 11 and a half years. Karen originally hired me. Previous to UT, I worked for the Duke University School of Medicine. And so when the medical school opened up here at UT, it was kind of a natural come back home for me to go back into academic medicine.
Thanks. Kevin.
I'm Kevin Crook. I'm the Director of Human Resources for the College of Fine Arts. I've been with UT for 10 years. I'm going into my 11th year. And before that, I worked in New York, where I didn't realize I was learning HR, but I was learning HR through a variety of many different odd jobs in the fashion industry and elsewhere. So I got a lot of good crash course on how to and not how to manage humans in a rather large city. So that was fun. And then I realized I loved HR.
So just to give us a baseline right out of the gate, let's make sure everybody understands what performance management is. To a new manager, how would you define or describe what performance management is? What is it, and how does a manager do it? And open this one up to anybody who wants to jump in first.
I'll jump in. We describe it at the medical school, although I think that we stole this description from Karen, as an ongoing dialogue throughout the year between a manager and their employee about the expectations of the role and how one's performance is matching that.
That's nice. Anybody else want to add to that?
That was much more written down and specific than I would have come up with. So I'm gonna go for it, Karen.
Oh, I was going to say, a lot of times people think of performance management as like the bad things, but really performance management is the overall process. So the good conversations and the difficult conversations.
Yeah.
Okay,
And
so
hopefully it's something that you do in an informal way or formal way, but an informal way actually helps you get to know the people you work with, and builds trust, I think, all the way around, which I think helps with retention and stuff, performance.
So this, I'm going to go a little out of order here because I think it's a good distinction to make. So you're talking about how some people sort of think of performance management as a bad thing. So what's the difference between performance management versus corrective action?
So corrective action is when you're documenting that there are performance issues that need to be corrected. So it's more of like the formal process. Whereas performance management, I think like Elizabeth said, is that ongoing dialogue. Like when we teach the class, we either show the picture of like the puzzle pieces all fitting together, which is like performance appraisals, feedback, setting expectations, or like the continuum, like that you're constantly working with your employees on their performance.
Okay, so then Karen, I'm going to stick to you for this one too. What is specifically UT's policy or philosophy on performance management? Like what is UT or central HR? What are the expectations of managers when it comes to performance management?
So we try to go by the principle of fundamental fairness that by the time you get to corrective action, you've already gone through and you've talked about, this is what I expect of you. This is kind of what I want your outcomes to be. And if it needs to be done a certain way, this is how you need to do them. And that you've given them kind of the information that they need to be successful. So that when you are sitting down with them, that it's not a surprise that, oh, I didn't know I was supposed to be doing that.
Okay, so that's often central, kind of look at it as a big umbrella, setting the sort of the bar. And then from a CSU level, what the three of you have to add to that? So when the rubber where the rubber meets the road, how do you add to that philosophy?
Well, I think there's, they are required at the University of Texas. And, it's something that, we want to make sure we have to certify each year that we've done a performance evaluation. But before that, you're talking all year long, hopefully. And it's not just sitting down at the end of the year and doing something pejorative to allow your employee to get a merit raise.
Yeah, I would add, just to add on what Jeff said about the year-round philosophy. I like it, for a performance appraisal to be just sort of like a very easy thing, where it's just sort of like, okay, there's no surprises here, right? We've already talked about this. This has been a constant dialogue that we've had all year. And I think I would just add, even though I think might be mentioning this later as we talk, is, starting with day one, right when the employee is sitting down with you, the manager, in that first day. I think that is where I've learned in HR over time to be much more front-footed each time I go through it with managers about it's okay to be explicit, right? I think when we talk about management, there's reticence, I think, with some managers, especially new managers, to be really explicit about expectations on the first day, because it sounds like, oh, I want there to be this honeymoon period. I want there to be this period where we're kind of happy and getting along, and just let it kind of ease its way in as we onboard. And as I've gone along, the more that I, as a manager, and also see other managers, sit down and just be really upfront and say, these are my expectations. These are the things that are really important to me. This is what success is going to look like for you in that first day, first week. And to keep going through it over and over again is okay. And it really creates a sense of, okay, I understand like the boundaries of expectations here, especially in these early few days, early few weeks, that prevent a lot of misunderstanding later. And I think, and we'll probably talk about this more, but I think it's where it's where the assumptions, where a manager has a certain set of assumptions and the employee has a certain set of assumptions about certain expectations, where that starts to go off the rails. You can prevent that a lot by that early explicit set of conversations.
And it
Yeah, I
seems,
definitely. Oh.
no, go ahead, Karen.
I was gonna say, I definitely agree, because, you know, like even just a personal example, which I give, is like when I first started at UT, no job where I'd worked before had someone actually been like, the start time is 8, you will be here at 8. And if you're not, you're late and you're going to have, and so like, it was a while. I'm coming in at, 8:07, 8:10, whatever. And then my boss was like, you keep showing up late. And I'm like, I mean, late, I'm here, like, and I'm staying. But it was important to that manager that you came on time, not the get your work done. And so I think even things that we might think because we've been here for so long, or this is how we've always done it, that may not be how someone else has done in their career.
Yeah, I think for me, adding on to what everyone else has said, I don't like any surprises in performance management. It should be nothing new. And one thing that we're doing within the medical school and UT Health Austin is really digging in deep to our onboarding, to Kevin's point, to really make sure that everyone understands the role, understands the structure, understands the expectations. Because, I think we're talking about this at some point later, when you've got new employees and you've likely had a need for them for a while because you've been recruiting and you're so excited they're there and you just want them to start helping and picking up some of the work, that we miss a lot of those crucial steps in making sure that they have adequate training. And even, in healthcare, how to be a medical assistant, but you may not know how to be a medical assistant in our environment. And so we're working a lot about our onboarding to really try to prevent those mismatch experiences for the manager and the employee.
But strengths and having these discussions with your direct reports and managers really focusing on direct reports strengths. And that's sort of something that's really popular right now. And I think it's noble and it's good. And, the idea is that when you have these performance discussions for a supervisor to identify strengths so that that person is able to, grow in their careers. But what happens when that person's strengths doesn't seem to be aligning with the work that needs to get done?
That's such a good question. This is just me being honest, because now I'm gonna pick on you, Karen. I would honestly go to SWS and be like, what do we do about this situation? Because I do think that it would be so great to turn something into an asset, right? Like if there's a misalignment there, to understand, and this is me now asking as an honest question in HR, to what degree do we have room to approach or work with an employee who looks like they could be strong in a different way than what their position is, and how much room do we have to adjust that?
So it's kind of that's broad. But I think it depends on what kind of flexibility you have in your own way. And so there's, everyone has their strengths. Like I would say, like even among my team, some are really strong at employee relations, some are strong in compensation, but you have to do a little bit of all of that. And so I think it's just trying to give them things that balance both. So here's what your strengths are. And then but part of your job is also to do this. And so let's talk about things that are going to help you build up that. But also if you have the opportunity where you can change their job, change it.
Wait, hold on. How much room do you have to wait?
Change it. Just change it.
They just changed the job profile.
Yeah.
Okay. But I think I think I understand, Emil, in that like it's natural, like Karen was just saying that you're gonna have someone who, like I like to say, like votes with their feet, right? They just happen to enjoy or are really strong at a certain part of their job, and have less enjoyment or less motivation to do another part of their job. And I'm just wondering if this is part of the question. So how do you work with that employee to still do the part of the job that you need them to be doing without mapping the position so much to the person that you lose the functionality of the job as intended for the organization? Is that right?
Yeah, that's well put, I think.
Yeah.
Yeah. What do you do, Elizabeth? Because I was going to
It's like my answer.
Well, I would say, I heard it kind of like you just described it, Kevin, right? So I always encourage our managers to imagine that incredible performer has just won the lottery. And so they're not here anymore. So like, what is the actual job that they need done? And what are all of the other jobs? They might have vacancies. And, when we have vacancies, we always try to level set and say, okay, is this an opportunity to restructure how we're going to get our work done before we repost? And think about like, okay, what are the needs of our team? And sometimes the needs of a person will outpace the needs of, the qualities and the strengths of a person may outpace the needs of the team. And I think that we have to acknowledge, where we might not be able to support, we can't have a team full of, senior leaders and no one, helping do, support work. And so there might be a cap in that. And then we look into other areas across, the school. But I think everyone has strengths and weaknesses, not everyone gets to do an entire job wholly related to their strengths. And, there's an argument I've been reading about, okay, intellectually, we are less likely to develop our weaknesses than we are to refine our strengths. And that may be true, but I think you have to look to do both.
That was really well put. I think it was an interesting take on the pacing too. And I think that's true and probably hard for managers to do sometimes, thinking about, this is a high performer that I need to let go. Right? Like they're going to do better somewhere else. And I need to, find a spot for them that's not on my team. A question came in that it's a good one, so I'm going to read it here. A lot is being reported about the increase in mental health challenges such as anxiety due to the events of the last few years. What do you recommend managers do to balance performance expectations with an employee's mental health challenges? Another tough one.
I like that one.
Yeah.
I think it's the two immediate thoughts I have are boundaries and support, right? So boundaries again, I think this happened for a lot of managers during the pandemic, is especially if you have like a lot of empathy or emotional, intuition with working with people, it's easy to kind of get sucked in to wanting to help everything or wanting to help everyone. And that can be really exhausting for a manager. And so it's good to kind of know where you're going to have to say, that sounds really hard. And like, again, like listening and supporting compassionately, like that sounds really hard. What's going on? I'm sorry that this is happening for you. If there's a certain disclosure that's happening actively with you from the employee to the manager. And at the same time, it's just saying like, I want you to be aware of the resources we have on campus. I want you to be aware of EAP, Employee Assistance Program, the things where you can, as a manager, lean into handing off where your expertise kind of ends or your strengths end, and where other resources exist for that employee. Because I think where it gets tricky for managers is when they maybe go a few steps down the road too far in compassion and get stuck in the story or the narrative of the employee and trying to help them to the point where they are overextending themselves and getting actually into really blurry boundaries with the employee in terms of trying to be supportive. So I think it's really good to be able to, for you as a manager, to say like, it's okay for me to not solve this for anyone, or it's okay for me to step back and sort of establish a boundary here. And it's okay to sort of listen and be supportive to a certain degree and say, I'm sorry that you're going through that, and to know what the resources are. So I think it's really important to familiarize yourself with the resources that we have on campus and to ask the employee, like, have you taken advantage of these resources? Do you know about these resources? You know, knowing too that you can rely on your HR you know, executive in your unit to sort of say, hey, I'm having a hard time with this. I'm not really sure how to support here. But I think another really important thing is to not feel like isolated, so that you're trying to solve it all. Because I think sometimes I see managers do that too, where it becomes very isolating, where they're trying to support the mental health of another employee that they care about. But in doing so, they can isolate themselves and not actually be familiar with the resources that are available on campus to support them.
So I think that there's a follow-up. I don't know if it's the same person, it's anonymous, but I think that they were sort of hinting at it in the original question too. What do you do when there is, you know, anxiety, mental health issues, but the work still has to get done? So, I mean, the way that this person, again, related the question, do you adjust expectations, and to what extent, what happens when there are hard deadlines?
Yeah, you know, in thinking about this conversation today, one of the, you know, questions was, you know, that I considered was thinking about like one of our more difficult performance management challenges that I've encountered. And in medicine, you know, as we have physician leaders and physician managers, we tend to view, or I tend to see my managers viewing everyone as a patient. And then that line gets very easily blurred, where instead of recognizing their performance, we want to recognize them as a person who has maybe, you know, emotional and mental health needs that we want to prioritize. And it is a balance, because I think especially coming out of COVID, we're seeing that need to look at the whole person employee and not just the worker employee. And, you know, I have to encourage, especially for medicine, because we cannot be diagnosing our employees, you have to encourage them to really focus on, like Kevin said, making sure they have all the resources that we have at our disposal, to supporting them, but being clear, because you know, the crankier HR professional of me says, you know, if we start recognizing one person's needs, we've actually given them an accommodation, and we need to be careful about where that can lead to unintentionally without going through the right resources the campus has. But that, you know, working on a large, diverse campus like this, that is one of the incredible benefits, is the wide, you know, resources that we have for our employees in terms of mental health, ABA resources, pathways to seek support where we need it to be successful in our roles.
Mhm.
Elizabeth, I think you mentioned exactly what was on my mind too about ADA support. I think that especially in the one that you're bringing up, Emil, would be where I would encourage the manager to resource this for the employee, because once we're able to at least understand, and I think our ADA office is incredible here on campus. Once that conversation is established between the employee and ADA and brings in the manager, then you have a little bit, I've noticed for managers, you are removing that fear about, oh my gosh, if I now talk about performance, that I'm attacking this person, you know, on a kind of personal level about what's going on with them. And I find working with the ADA office, it gives you that lane to still feel like, okay, we've, you know, the employee is getting support and has some resources here. And we're able to understand through the ADA office where we're still able to still have expectations on performance. And I think like if you don't have that conversation or don't have ADA involved in a situation like that, then it becomes really hard for a manager to feel like comfortable on talking about performance, because there's always going to be this like, oh, I'm not sure if I should do this or not. That creeps in and prevents things from really moving forward.
Karen, do you have anything to add to that?
And I'll say my internet cut out in the middle of Kevin talking. But I do think ADA is an excellent resource, and they can help with, even if it doesn't become a formal accommodation, talking through, okay, so they can't miss this deadline, but are there extra things that you can do to help them manage getting to the deadline? Or there are different resources? Do you have more frequent check-ins? Things like that. But overall, don't just let them miss deadlines. Kind of work through and have conversations with your HR executive or your SWS consultant about kind of how to approach these types of issues, because they get very complicated.
And I would also add too, the earlier you're able to resource and have those conversations, the better, because to Karen's point, I've seen managers wait too long, and then they kind of cross the line into resentment, where they're mad at the employee for something that, is not the employee's fault necessarily. But by that time, like once they've kind of mentally crossed this line, then it becomes a little bit more, it just festers into something that it's harder to work out.
Yeah, I would agree with that totally, because one time I had somebody who was like, got completely fed up with one of their employees, like completely fed up, didn't tell me whatsoever. And I go back and she has kept meticulous notes on all of the things that have gone wrong and all of the things that she's said and he's said, blah, blah, blah. But they're like, she didn't take it anywhere. So I definitely agree in getting the help when you need the help. I'm not an expert. I'm not a mental health, expert. I have several times people have asked me to serve in that role, and it's like, oh my God, no, I am not trained for that. You need to talk to the people who are trained, because I think they actually have, it also gets me out of, and gets a manager out of the employee expecting us to help with their mental health, not the performance of the work, but the mental health. So that's one thing I think is important about being able to resource it appropriately early.
I also agree. Do not ask Jeff for mental health diagnosis.
Sorry, go ahead, Karen.
No, that's I guess what I was going to say is I completely agree. Really, in all aspects of performance management, don't let it fester, because then by the time you're ready, by the time you're fed up, your view of the employee goes from, I want to help this person, to, gosh, this person just wants to get fired. And then that's harder to try to manage.
So this might be a good segue into explaining what a PIP is. So if you do get to that point where there needs to be some corrective action, how does that work? Karen, why don't you just start us out talking about what a PIP is and sort of how it works?
So a PIP is like a performance improvement plan, and it can take a lot of different forms. I would say, though, just to clarify, I do think in most cases there should be a few like feedback discussions before you move into the PIP, right? And so like, hey, I've noticed you're getting really close to these deadlines, or you've missed these deadlines, or you're late every day, or whatever. Like, can we talk that through and remind of the expectations? But really the performance improvement plan, what I like to see, and it doesn't always work, is that you're talking with the employee kind of about, okay, here's what I need you to do, and here's what you're doing, and here's how you get from here to here. And so that's kind of what the goal is to kind of help them get to the better performance before you're moving down that corrective action path.
Before we continue on that path, there was a comment in the Q&A asking that we clarify that health conditions, including mental health, should not be included as part of the performance appraisal summary. That's a really good point. We were talking about mental health, and it may have been confusing to some. So just making clear that mental health is not part of the performance appraisal process. Okay, so back to the performance improvement plan. So what's the story? Like, how does one get to that situation where they are on a PIP? And then what's the experience for the employee at that point?
Well, I was kind of hoping Karen could answer what if you don't have the support of your own leadership or boss to address certain things. You would like to, you think things might need to be addressed. What if your own supervisor, my supervisor, is not supportive of that kind of.
Wait a second. So are you saying, so you're a supervisor and you want to put one of your direct reports on a PIP, but your supervisor says no? Is that what you're?
No, I'm not necessarily maybe not all the way to a PIP, but I'm just saying, like, what if you have, the appetite in your organization for either addressing something or like, oh, they're just 10 minutes late, don't worry about it. Oh, this person's nice, so we're not going to worry about it. So like that can get very hard, and it makes you as a supervisor appear like you're not doing anything to other employees. Okay, Karen, what's the answer?
I think Emil needs to schedule a managing up panel and include someone else on it.
That is definitely a managing issue. But
Yeah.
Oh, God.
No, Kevin, please.
I was just going to say, the PIP, it's funny you mentioned that, because there's also something on campus called a PIF, a PIF, which is what you fill out for when you're having an outside vendor come onto campus. So I just want to make sure, someone mentioned a PIF to me, and I was like, oh, they were talking about PIP. Yeah. So just wanted to throw that out there. But also it's funny sometimes the UT experience, how, and I'm sure our folks here may relate to this, is that the UT experience for me is like, I'm always collecting new things every day. And I'm like, oh, I didn't know that was a thing. I didn't know we were doing that. And so the PIP, like I've been aware of it, like as a concept, but I am being honest, I've never really said like, okay, you are now on this, right? The way that I've approached it with managers is to, really start out with, I kind of put it in terms of informal versus formal. And I think we're going to talk about corrective action maybe later on, but for me, whatever the conversation is, it starts informal. And what I mean by informal is that we're having an off the record conversation. We're having conversations kind of like what Karen was alluding to earlier about, hey, I'm noticing this. And you're just kind of speaking out loud and narrating what you're seeing, right? I'm noticing this. This seems to be happening. It's been happening more than 2 weeks. And because of that, I just wanted to kind of mark this in time and say that this is a concern because I'd like to see this instead. When this happens, the result is X, Y, and Z. It means that we're not able to start on time. We're not able to, if we're talking about, time management. And so that's affecting the team. The team's waiting, and that this is the ripple effect. This is what's happening for us. And so I'd like to see this, change, in the next 2 weeks or so. Otherwise, we're going to have to, get a little bit more formal. So I try to do it iteratively, or encourage managers to do it like iteratively. So the next step would be, let's put this all into an email and say like, okay, we've talked about these things over the past month. This is like container 1 of things, container 2 of things, and container 3 of things. And it's sort of like, for lack of a better word, a baby corrective action letter. It's like a junior soft-boned corrective action letter that is saying like, if we were to continue like this would actually look more like a formal corrective action letter. So that's, in my neck of the woods, that's what a PIP looks like. But baked into that is, and I think the improvement part of the improvement plan is, this is what we want to see. And I think that this is also like an interesting maybe side discussion, is like, what we want to see is whether that's a meets performance version or an exceeds expectations version, right? Because I think sometimes, and I realize this is like a side subject, is that you can say, this is what I want to see. And the employee could come back and say, that's like impossible. That's too much. Like, what you want to see is too much. That's an exceeds version. I can do this version. And there sometimes can be a dialogue there about what's a reasonable expectation to see. And, you know, again, Karen, I'd love to like chat with you later about, because I think sometimes that perception of like what the manager wants to see may or may not be reasonable, but we'd like for it to be reasonable.
Oh, yeah. And yeah, so I am going to just briefly go back to what Jeff had asked when I made the managing up joke. But I do think having those series of conversations, like the more you have a conversation or where you think about, okay, what is the impact of this employee not meeting my expectations? And you're saying that I can't talk to them because they're nice. But let me talk to you about kind of the impact that it's having on me and my team's performance. And then that also just kind of helps solidify for when you do talk to the person, because it's very rare that I see situations where the manager absolutely, once you try to talk to your manager about why you're wanting to have those discussions, can't get on board. I know it happens, but it just kind of helps even you more articulate what it is that you're wanting, and thinking through different solutions. So there's that piece. But I think too, I mean, I agree, performance improvement plans are kind of a broad term, and they can take on different forms, right? And so there's kind of the casual where you're summing it up on an email. There's another tool that we used to use, but it's not as widely used, which is called like the desired behaviors worksheet.
Mhm.
And I actually like it because it helps them get from one to the other, and it gets that employee to say, okay, here's what I can do. And it may be that it doesn't become formal corrective action, so that it's not living forever as like you got written up as a level one. Or you're keeping it in your supervisory notes so you can continue to address. But yeah, there are lots of different ways to.
So this might be a good, there's several questions here, but one of them is in line with what you're talking about right now and what Kevin was talking about. What guidance would you share to a manager who finds that they are at the point of needing to request a formal level one? How long should the informal coaching sessions go on before they need to request to formalize the corrective action?
Should we define what level
Yeah.
one means? Yeah. Take it away, Karen.
Ow. So it's the first level of formal corrective action. So it's called the level one. What are we calling it? The level one corrective action letter. That kind of just goes through, here's what it is, here's examples of what we're seeing. And then that's more of the formal corrective action. But I will say, it really just, sometimes it depends on the nature of the performance issue. There are some things that you can remind a few more times than others, right? Like if someone is throwing things at you, you probably should skip something else. But like there's a spectrum of performance issues.
Okay, so then let's get to the question then. And I think there's some subjectivity here, but they're wondering, There's really two questions. What guidance would you share to managers who find that they are at the point of needing to request a formal level 1? How long should the informal coaching sessions go on before they need to request to formalize the corrective action?
I get this question a lot, and it's, in my opinion, usually because they've waited too long to start having honest conversations. And so
Now
they're fed
they're
up.
very impatient. Yes.
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 And we always try to tell our managers, which some believe us, some don't. At the moment that you're having some sort of reaction to your employees' performance, you can't quite put your finger on it, but you just don't think you're happy, give us a call. We'll tell you if you're absolutely on track, or if maybe we need to think about better, training materials, or, more clearly defined expectations. But I always tell managers that I think that if they are really thinking about, okay, if I am that employee, have I had a reasonable time to fix the problem? And like Karen said, I use a very clear example. You're expecting them to be here at 8 every day, and it's consistently 8:10, 8:15, and they haven't articulated to you, okay, I now understand your need. I need an extra week to change my elder care or childcare, schedule. But they're just consistently not changing their behavior. I mean, that should, in theory, outside of, some personal things, be an easy and clearly defined fix. Then maybe, they're not meeting your expectations. You've got a big business impact. For us, that might delay our ability to room patients or start the OR. So it's, a pretty big impact, and we need to resolve that quickly. On the other side, if it's a, analytical question in their work product, and we do quarterly budgets, you may not have a true opportunity to understand if they've, had a turnaround in their work product until that next cycle. And so that's why you need to be clearly defined. And what I do find is people try to hang their hat on this one issue, but really there's many, and they're maybe a little non-confrontational. Of course, managers want their employees to like them, so they don't go into the full spectrum of concerns, and then they're stuck because they've never, talked about those aspects, and they're really talking about the larger fruit on the tree.
All right, so that's a really good point, and I we're talking about some issues that I think are really clearly defined in terms of metrics, like showing up on time or time management. But, and somebody was commenting on this as well, but how are other ways that you can assess expectations, right? So think of an issue that isn't quite that objective in terms of showing up on time. How else can you, especially during corrective action, how can you as a manager assess those expectations of a direct report?
I mean, I think it depends on the expectation, but I always tell managers, like, for example, in performance appraisal season, as I like to call it, sounds like football season, people are likely to enjoy it, that they should be prepared, right? If I give someone a meets expectations rating, I should be prepared to say, should they ask, what would an exceeds expectations look like? And I think that's on the manager to understand what they are asking that person to do, and what does success look like. And then I think they know, if they can define it, then they know when someone's not meeting that expectation.
I think Elizabeth is like, I'm so agreeing with a lot of what you're saying. And for me, there's generally, like, I think a little bit more work sometimes that managers can do ahead of time, like a little bit more like self homework about like, what really are my expectations? What does this look like? Because I think, going back to your point that you were saying, Elizabeth, about that feeling, I will also just want to add in that if you're a manager and you've got that, like, that didn't feel right, definitely go to your HR exec early. because I think the more you're able to kind of put words to it, generally it's a pattern recognition thing that HR folks are able to catch on and kind of give words to earlier. So then you can have, and I know we're going to talk about competencies later, but then you can have some language, because I think sometimes what it is that there is an intuitive thing that the manager is feeling but doesn't know how to articulate yet. And chances are HR has seen it, because we just see a lot of patterns. And we're able to name it for you. And once we name it, then we can get to, okay, then we maybe even could put some kind of quantification or articulation around meets versus exceeds on some of those things.
Let's do it now, Kevin. Let's talk about competencies. Tell me about what are competencies and how do you use them for, you have a great video out, but let's stick to performance management in this case.
Yeah, so competencies are how the work gets done. So there are a lot of the things that are kind of the things that maybe are outside the lane that are so meaningful to success in a position. Right? And what I mean by outside of the lane is that they sometimes don't exist on the page of the duties of the job, right? Like duty one, turn these papers in. Duty two, meet these quarterly goals. Duty three, these sort of like hard technical deadline things that we can kind of point to and quantify. Whereas the competencies are how they're doing it. So if they're tripping people in the hall or punching people in the face, that's a super example, right? Super extreme example. But the point is that they're not being nice while they're doing all these things. So they could be like their V lookups could be like chef's kiss, and like everything that they do on paper is just beautiful, but they're not nice to anyone. That not niceness is probably a cluster of competencies. Maybe it's teamwork, and then you say, well, what is teamwork? You break that down as how do they work with their team? Like are they nice to other people? Do they sort of just try to undermine other people, or I'm sort of flailing on how to
do they not share information with
Right.
their coworkers?
Yeah, is it an extreme like CW version where they say like, I want you to fail right before they go into a meeting, right? Like it's something that, again, I'm being extreme, but the point is that there are behaviors, right, that they do that you can articulate and sort of talk about and define and say like, I see you doing this. Like I see you saying mean things to Karen. My ideal is to not say mean things to Karen, and in fact support Karen as your colleague and try to help her also be successful. So once you're able to talk about what a certain competency is, and I always pick on effective communications because I think that's like a one that's
A core.
built into almost it's a core competency. Once you're able to define that and have that conversation with the employee about this is what I think effective communications is, and talk about why it's important to you and what it looks like, because that can break down into what emails look like, how you communicate on Teams, what do you communicate, to whom do you communicate, those kind of expectations. Once you start articulating that as a manager to the employee, then you've got some sort of framework again to work with to measure whether that's happening or not.
And you can tie them to the positions, right? So you can say in this particular position, communication or collaboration or whatever it might be are really important. And because you're not fulfilling these competencies, you're not doing the best that you can in that position.
Yeah, absolutely. Going back to the technical part, right, is like this, because the person may come back and say, I'm really confused right now. I feel like you've just pulled the rug from under me because I am killing it when it comes to the technical parts of my job. And you're like, right, but that's not the full part of the job, right? The full part of the job is also how you do it. And if you're not doing it right, you're not fun to be with. You're just not a fun employee. And that affects the whole team, right? And I'm being sort of very frivolous with saying fun, but there is a certain aspect to that if other team members are not feeling safe or well around another team member, that's a problem. And I think it's important to articulate that and have an expectation for those behaviors.
Right. And they may not even realize that they're being mean, right? Or not helpful. And so that's why I think it's good, like that open dialogue that helps build trust, like letting them know, hey, these are the competencies and the behaviors associated with the position. So when you repeatedly call someone right after the other, and not taking into account that they might be in a meeting or they might be working on another issue, like that's not how you should treat a call. Like it's kind of like those behaviors, and they may not be aware that they're really doing it.
And Emil, also to just be less hyperbolic about it, because I always start with like, I think Karen does this too. You start like, it's easy to talk about competencies when you're talking about the jerk,
Yeah.
But for maybe a more everyday one is like initiative. Initiative is like one of my favorite competencies.
Yeah.
Because it's like, I hear managers sometimes saying they're doing okay. And I'm like, okay, well, what's going on? And they're like, well, I just wish. And then they talk about like, there's not like a curiosity, or they're not, like I sort of say like, I'd like to, for us to do this, and then nothing is moving forward or nothing happens. Sometimes that conversation leads into talking about the competency about initiative.
Right.
And initiative is a word to unpack, right? I think that's the other nice thing that I like about competency is that, again, the manager ultimately, we have the competency library, like we have these sort of kind of helpful but stilted, tinny definitions of what each competency is. It's important for the manager to read those over and then say like, okay, and this is now how I understand it to be, and this is what I want to see. Because I think sometimes too, in the relationship I've noticed between a manager and like reading what we have in the competency library is feeling like it's not theirs, feeling like it's like a written kind of, stilted definition of a thing. And I've been working more with managers to say like, make that your own, like make that competency one that you care about so that you can feel confident in asking for it. And then once you care about it and know how to articulate it, it's yourself, then you can talk about defining it in a way that you're both on the same page. Because that's the other thing is like, you could sort of define it and say like, I care about this and this is really good. And here's my definition of it. And the employee's like, I don't understand what you're talking about. Then it's still useless.
Yeah.
You still have to have that conversation to make sure like it's a joint understood definition. So
I think it exactly kind of goes back in a circle to what Elizabeth started out by saying, which is be able to sit down. If you give somebody a meets expectation on their performance review, be prepared to tell them what exceeds expectations looks like. Same thing with this, like with your competencies, they're going to say, give me an example. Tell me how I'm not nice to people. I think I'm super nice.
Right.
And you need to have thought this through, and very much be able to answer the questions. And when you can answer the questions, then you can go.
So you touched on this already. We have a lot of territory and the questions are coming in. So we'll try and move it along a little bit, but we touched on this about how, positions, competencies are defined differently in different positions. But let's talk about it in terms of performance management as well, and how you need to think about how managing performance is different according to position as well, right? So let's have some conversation about that. We work at an institution of higher education, lots of different positions, from facilities and custodial to administrative and accounting to faculty. So Jeff, let's start out with you. What you've been here for about as long as I have. What is your experience in terms of how different it can be to manage a performance for all the variety of positions that we have at UT?
Yeah, it can be very different. Everyone says, or you hear people say, oh, you need to treat everyone the same, but it's very hard to do that. And so like when you're managing performance of a student, like the front desk student worker, it's going to be different than when you're managing a front, somebody else who's a regular staff member, perhaps, maybe not. But my what I wanted to add on this one specifically was the difference of being managed by a faculty member or a staff member. So like there seems to be different expectations, and we can have conversations, amongst staff sometimes about setting expectations, clarifying competencies, blah, blah, blah. And it's more difficult to have a tenured faculty member want to pay attention in the same way, because they're evaluated on mostly on completely different criteria. So, I think it's you have to know how when you work for a faculty member, you're going to be managed differently than you work for a staff member, most likely. And you just need to learn to maneuver that and what works better. And again, in the end, it's basically every person requires different things and done in different ways. And that's why it's important for supervisors to have those conversations.
Elizabeth, how does one manage the performance of a surgeon?
Yeah, right.
But how does one, how does a different world in a medical school, right? So how different is it in terms of management performance at Del Med?
Yeah, I think that something that a lot of healthcare is experiencing that you may not realize as a patient is you might have, 5 people who come visit you in any given day as a patient, and they all have different employers, so it's not a direct, this person managed this person, manages this person. And so I think that's a complexity that we face, especially as we see nursing staffing shortages and other entities, being created to address these gaps. The physician learner dynamic, I think, is pretty interesting from a performance management standpoint. People like to think about Grey's Anatomy. I haven't really watched much of it, but apparently that resonates with folks. You've got these people who have finished medical school. They are professionals. They are very well educated. They could theoretically go and practice medicine independently, but they are in a residency to, focus on a particular skill set. And so they are a learner. And so there's this question when we get to those learner positions of, is there a gap that is part of their learning or a deficiency in where they should be today? And indicative of, a performance question. And so that becomes a very intricate gray territory that we try to very carefully sort through in how we manage our physician learners. And then, whether they're a learner or, practicing what we call attending physician, we have a strong set of regulatory bodies that we also have to work through in terms of how we manage our physician and provider performance issues. And there's a strong set of legal aspects of, when we're required to report things, what we're required to report. And that's what we want, right? As a consumer and a patient, we want to make sure that there is a very strong expectation of, accountability as an industry for the healthcare that we receive and that someone provides. But that makes it complex, and making sure that we're reporting these things in the right places, managing in the right places, because with those regulatory bodies, we have to ask that question: does this person need to improve their performance, or is this person unsafe? And that can be where, for a staff or maybe other industries, we can decide they're not a fit for us. We can decide that they're not successful here, but that's not going to end their career. In healthcare, depending on the path we choose, it could very well end their career. And so we take that seriously, balancing, ending a career, potentially, bad outcomes with a patient.
Anybody else want to add to that? Or add to differences in managing performance with physicians? Let me go to a couple questions here. This is a scenario question, but I think it's vague enough that we can touch it. So the scenario is that people are coming to you with complaints about specific issues, maybe it's incivility, let's say, about an employee, but that subject, that person is never like that in front of you. But you know that it's happening because of the frequency of the different parties that are experiencing this incivility because of that person. So you ask, you want to have the conversation with them, but none of the people who have experienced that incivility are willing for you to actually use those examples in the discussion, right? Because they don't want to be called out. So how do you handle that discussion with the person who is being accused of being incivil?
I'm wrapping my brain around this one.
I'll give you some seconds before I.
So just to understand it.
Yeah.
Say it back. So there's employee A who is reportedly being uncivil, and other employees are reporting this to you, HR. But you,
let's say a manager.
Manager, but you, manager, have never seen it.
Correct.
I mean, so first take would be manager go to HR and have the conversation about what they're experiencing. I think that's where I would start to say, how should I frame this? Because I think what would be tricky is you need to have some sort of considered method on like, how am I going to get all this feedback, understand all the pieces involved, and B, then go about having some sort of conversation. And so I think what I would advise is at least to ask the manager to start with HR because again, like I think you can have some sort of conversation about where are we so far, what do we know so far, and what do we not know? Because I think it's really important before you're doing any sort of, like, for lack of a better word, intervention, to be able to fill any gaps that you don't know before sort of making any sort of approach about trying to change the situation, unless, right, there's a deal breaker about safety. Like if there's a deal breaker about safety, Title IX, Title VII, like one of those things, I think you would have to move much quicker.
Yeah.
But short of that, I think you do want to gather and be considered before, because once you make sort of, any sort of intervention, especially if it's the person in question, there's a rupture that's going to happen. And once that rupture happens, it's hard to undo that rupture. So you want to make sure that you've got everything that you understand to be so true before you do that, because you can't really undo it. So
okay, Karen. So let's say they go to you as HR. What advice would you give to a manager who's in that situation?
I think they were talking about going to your departmental HR person and not to.
Oh, so let's say that's how it works here.
I would say, yeah, it is. I don't like these situations because I get the employee is feeling very vulnerable, right? Because the people that are bringing the issues are feeling vulnerable because they want the situation to change, but they're scared about their part in making it change, right? Is that kind of what y'all are saying?
Yeah, I think that's, yeah.
And so, I mean, I agree with Kevin. I mean, it depends on what the issues are, but there's some things that even though you yourself haven't observed it yet, like, are there different ways that you can try to observe that type of behavior? Are there other indicators? Are there other pieces of information that you can get?
To me, like, I get it, right? As a manager, you hear this, I think we want to fix the problem because we have one team member who has a problem that we feel like we can fix and we're accountable to fix. And so it feels like a very reactive thing. I would say this is indicative that you have a team issue, right? You've got some inconsistencies there. It's not going to be the rip the Band-Aid off approach. And I know this sounds a little maybe soft for what someone might want to hear, which is not usually my forte, but I think you got to do some team building activities, understand, because that other employee who might be quote acting differently, they may have a perspective, to Kevin's point, like filling in those gaps where, yes, they're frustrated because the work product they're getting from their team member is always sloppy and incomplete. And so therefore they're always having to clean up that other person's work. And there's something going on there, and doing some, activities, and like we've done things, everyone, I think COVID's a great example. Everyone had a different experience during COVID, but they were all valid experiences. And I think that as a population, we started to accept that people could approach the same thing differently and come out of it differently. And so we did a lot of team-based activities with like jam boards where you could ask a question and anonymously put post-its in, with things that were meaningful to you or things that were stressing you out during COVID. And I think you can use some of those activities to adapt to your team about like what are positive team behaviors and what behaviors take away from the team environment, and try to build it versus correct it. Because I think that to me is the first sign, means you've got a problem in your teamwork, and not necessarily a specific performance problem. It might get there, don't get me wrong, but I'm hesitant to jump straight to you've got one problem employee.
Yeah, I think that the sort of common theme there is that you can't make the assumption. The wording is that they're not working well with others in the question, but you don't know what the perspective is of that person who might feel like they're the ones who are not being treated well, right?
And able to, I think this is something that I would mention too, is it's good to notice as a manager when people, especially when people come in hot and like, there's like, I've got this is happening, to know yourself, like what presses your buttons. So like if an employee comes in with an issue that you either actively or subconsciously know is an issue for you that makes you sort of want to fix it or solve it, sometimes it's good to know that or about yourself, because jumping in and trying to solve something or fix something too soon can sometimes make things worse, without knowing the full story. And so what I mean by that too is like there are so many permutations of this example, right? Like each use case is going to be so subtly different. But one of the permutations that is always on my mind for HR is gender, race, religion, with the employees involved, and how someone's perception of someone else may be a misread, right? And so, and that jumping in on that too quickly just can be even more problematic. So I think from a DEI perspective, sometimes when, that's just another kind of lens or filter to think about in a situation like this, depending on the use case, is what is being brought to you as the manager that is part of the team dynamic that maybe also has to do with protected class.
So that's a good segue. Let's talk a little bit more about diversity, equity, inclusion, and belonging here. How does that factor in to performance management? You need to be mindful of belonging. How do you factor that in to performance management?
So again, early and often in defining things, I think that's where competencies come in handy. I was working on a job description just today, from a unit where one of the required qualifications was professional demeanor, which is a personal pet peeve of mine, professional demeanor, because I'm like, well, what does that mean?
Red flag.
Who's asking the question? Who's defining professional demeanor?
Yeah.
Or countenance, or is there any sort of thing that has to do with like how I'm reading this person? And so again, that where I try to ask deeper questions of the person defining that, and that comes in because that maps right into performance management. And so I think, again, for me, competencies is a big part of that. And again, having that not just be defined by the manager, kind of holding on it and like hiding it, and then like, haha, you did this wrong. But to have that conversation, day one, week one, continuously about like, this is what teamwork is for me. And I want to share this with you to sort of say what it looks like and doesn't look like. This is what effective communications looks like for me and doesn't look like. I think that's part of it, Emil. It's not not to be simplistic, it's not the only part, but it's an important chunk to help define.
Okay, so professional demeanor, that's a red flag. Culture fit, that's another red flag when we're talking about, belonging. Anything else that you want to give some advice to managers about? If you're thinking in those terms, you might not really be in tune with DEIB.
I think thinking through, okay, this is the way that I like to approach work, but it's not the only way to approach work. And how inclusive are you being as far as how people approach work? If you're the person that likes to just talk everything to death in a meeting and come up with a solution, whereas some people on your team may be the people that like need to go back and think about it and then come up with a brilliant idea. And so I think talking through with your team and being aware of how other people work and that it's not wrong, it's just different than you, and making adjustments for that too is important. So I think just checking yourself to see if, am I being rigid or am I allowing for flexibility?
Anybody else want to add to that?
As it relates, I think sometimes when we think about the way I heard the question was more specifically about corrective action and DEI potentially initiatives. And I always tell people to really focus on the business impact. Like Karen said, not the way that they're doing the work, not how they got from point A to point B, as long as they got there within your expectations. And if they're not, like, is it that you're annoyed, you don't like them? Those things you got to put aside. Like, you need to think about what is the business impact. And again, that gap in where they're meeting your expectations or not. And I think that's, for me, a clear way to really suss out, like, are we being equitable? And it should be very easy to do, when you think about just the business, the work at hand, what we're here to do, and are we doing it?
Make it as objective as possible. There's two questions I really want to make sure we get to. And they're both roundtables. I want to get everybody's input on this. So I apologize for the attendees if we're not able to get to your questions. But the first one is, what is the biggest mistake you see managers making in performance management? And if we could just try and keep it somewhat brief so we can get everybody around. So Elizabeth, let's start with you first. Want me to repeat the question?
Yes.
What's the biggest mistake you see managers making in performance management?
I think waiting too long to address the heartburn that you go away with every day at the end of the day. If you have heartburn going into one-on-one with the employee, I also think not having enough one-on-ones with employees is a big mistake, because then there's just so much tension for both managers and the employees going into, having a discussion that kind of detracts from the ability to have a productive conversation. And, people will ask me, well, how often should I be meeting with that person? And, I think there is a point at which it's too often, but I would guess that most managers are not at that line. So I would say, biggest advice to avoid those mistakes is meet regularly and address problems early on.
Jeff?
Yeah, my biggest thing is do not wait to start talking about things. Again, it can start out as an informal chat. It could start out as calling Karen's group and getting some advice on what to say. But the longer you wait to address things, the more daunting it gets, potentially the worse the behavior can become. And it's way harder for you to come back behind it and try to fix it up. So I would definitely say talk about it early. And I hadn't really thought about Elizabeth's point about meeting meeting regularly, but it's true, because once if you don't ever meet with somebody, and then I don't ever meet with the provost. If I got called in to talk to the provost, I'd probably be just like, what, I don't, but if I met with her every single day, it wouldn't be weird.
Right. There's no context to
Right.
build a conversation on.
So
Yeah.
that's an excellent point, Elizabeth.
Kevin?
Yeah, first I'll just say I agree with Elizabeth and Jeff for sure. Shout out to Julia Tofano in McCombs, because this is her idea and I've stolen it. But the intake interview for a new employee is a great formalized way of being explicit about your expectations and having a vehicle for it. So if you feel awkward about it, to have a vehicle that takes you through it. And I think that that's something, again, it kind of couples in with what's already been discussed about early and often, but it's the communication part. It's about articulating and defining the things that are important to you as soon as possible, and to course correct. I mean, like, okay, not this, but this, as part of those one-on-one meetings early, so that you're kind of refining it until you get to the point where you're like, okay, yeah, we're both on the same page.
Karen?
I would say, and I think this ties in with everything else, but going into it with kind of the predetermination that the employee is trying to do a bad job or is a bad person, because that comes off in the conversation you're having with them. And I can say, in sadly 22 years of doing this, I can really not think of a person that has really come to work wanting to do a bad job. And so I think going in with the attitude of they're trying to do it and let me help them is better than going in with the attitude of they just are lazy.
Right. Just making the assumption that, yeah. I think that you may have answered this in the way that you answered this first question. The other question was, give us one piece of advice to managers about performance management. If anybody has something in addition to add to what you already said. Yeah, Kevin.
This is kind of like a medical field term, but I would rule out. So rule out things. So rule out ADA, rule out FMLA, like all of the other things that could be reasons for performance not doing well. Make sure that you've resourced and talk about those as soon as possible, because then you can feel a lot more confident about addressing performance.
Anybody else?
I think we said it earlier on, but not in context of this question, but I think Kevin kind of hit it on the head, in that something that a manager may not be able to describe, working with your appropriate HR contact, they can help you describe that. They can help you recognize what you're experiencing. People sometimes say to me, like, I don't know how you don't get flustered, by dealing with some of these issues all day, every day. And I think the reality is, for an HR professional, that's the value we bring. We do this all day, every day. And so we don't get flustered. And so we're able to help take some of the emotion out and help you earlier on get to a productive path and a solution, rather than just be frustrated. So that would be my other bit of advice.
Yeah, I agree with that. I think a lot of times, because people are like, well, I'm a manager, this is part of my job, I'm a person, I'm managing people, like I know how to do this. To me, it's kind of like, and I've given this example before, so y'all probably heard it, like I can amazingly replace a thermostat, but I can't fix my HVAC, so there are some things that you can do, but utilities is not calling me to help with a power outage. But you should call us to help with a person question.
A people problem, yeah.
Yeah. Mm-hmm.
Yeah, that's great. So there's this question, I'm going to wrap it in to what I wanted to ask about to close us out. Do you have suggestions for managing all around good performers? I'm concerned that I may only address when performance needs some adjustment and don't want to convey only concerns when they're doing satisfactory, great, good overall work, but they're just doing their job. I don't want to be condescending in overdoing the gratitude, if that makes sense. So the way I'm going to wrap it in, because I'm obligated to talk about this as the director of learning development. How do you talk about professional development and learning development? My philosophy is that these performance discussions, you also need to be talking about how they are learning and growing on a regular basis. And that's one thing you can do with, high potentials, high performers, is not just talking about what they've been doing, but what they could do and how you can support them in their developmental needs. Like, this is a competency that I think you could really benefit from, and here's some resources, or contact learning and development, so they can help you develop those skills or those competencies that you need so that you can thrive in your career profession. Thoughts, comments, questions?
Emil, I was just, the other thing that came to mind for me immediately was the stay interview. I'm a huge fan of a stay interview, because it just to define it briefly, it's an interview you have with the employee to say, hey, you're high value here. What's working, what's not working? How can we keep you?
Thank you for bringing that up. It's a great point.
Because it's so gratifying to hear that as an employee, just to kind of like, especially when it's like not on season.
Right.
And it helps both of you. It helps you identify truly, like, what can we do besides salary? Because sometimes salary is tough, right? But what are the add values that we can do to this person's experience that maybe extends another year or two that they otherwise would have been looking? So I love the stay interview. I'll just keep it at that.
Anybody
I
else?
like that. I hadn't heard it referred to as that. But that's a great idea. I do try to get to know people. I try to get to know their name, their spouse's name, their significant other's name, their kid's name, where their kids go to school. I try to be able to, at any point, carry on a conversation with them, because I think it really helps. I do this with our faculty too. Certainly not just staff members, but with faculty. Like, I know almost all of our faculty's business, and the reason I do is because if I'm stuck in an elevator with one of these people, I want to be able just to have conversations. And it just, again, anything you can do to facilitate conversation is a great icebreaker, and that's kind of why I do what I do.
I would say for most of us, there are some positions that are like kind of that up and out, right? Like, if you're not moving up to the next level.
Right.
But I appreciate a good solid performer, like, it helps provide continuity. I would say if you're trying to give them feedback, like, that's like, I want to keep you, like, don't be like patron, like, is that kind of what you're asking? Like, how do you kind of keep them going? Is that kind of what the question is?
I think so. There's nothing, I think the person asking, like, there's nothing that they can point to. Like, they're not really doing anything wrong. It's meets or it exceeds. And so in that way, they're having a hard time really giving them some guidance, because it's solid. They're getting the work done, and they're getting it done on time. They're doing a good job. And so how do you have that conversation in performance management when it seems like we keep meeting all the time and it's just like, you're doing fine? And that's why I think there's more than just the work. A big part of management and leadership is developing them.
Yeah,
right? That's why I learned.
It's good to have a conversation with that employee. Do they want something different, or are they equally just as content to be a solid performer who provides continuity, knows their job, knows they're good at it, and appreciates that they can contribute in that way? Because
that's a very good point, because you can't assume that what that person wants or what motivates them. And so, I mean, that's an excellent point. Sorry.
Well, we're at time. Thank you all so much. As I mentioned, this is going to be recorded. We're going to have it captioned up on the YouTube channel. We'll send it out in our monthly newsletter. But again, thank you all. This was great, and I hope very informative. It's certainly a learning experience for me. Thanks, everybody.
Emil.
Bye-bye.